Hi everybody, I'm Dr. Short with Bluegrass Chiro, and today I'm going to talk about sleep. 65% of Americans have trouble sleeping, and I'm sad to say that I was one of them. For about 5 years, I got anywhere between 1 and 3 hours sleep, and let's face it, it starts to grate on you, but I'm not alone. Like I said, 65% of Americans are having this problem. And as an academic, I said, I'm going to figure this thing out. And so I did every potion and lotion. I read every book that you can imagine. I've had procedures done, all kinds of things, and really not much helped at all. Not much helped at all. Until I discovered a device, a FlexPulse. What a FlexPulse is a pulse electromagnetic unit. Basically, that means it gives off a magnetic pulse. And so when you look at the brain waves, if you're studying or you're trying to concentrate, you could have a brain wave about maybe 10 to 15 hertz. That means 10 to 15 times a second there's a firing of a brain cell. When you're sleeping, however, you will have a frequency of about 3 hertz. That's deep sleep. So what this device is going to do, we're going to teach you how to charge it and use it, of course, here, but then also how to turn it on so that you get that 3 hertz, 3 times a second. That 3 times a second, then when you have it close to your head, eventually your brain will go completely in same wave as this pulse, and you'll feel tired and you'll fall off to sleep. And because we want to sleep the whole night or as long as we can, what we do is we put the unit on continuous so that you can have a full night's rest. It is the only thing that's been able to help me with my sleep problems. I've been using it now for about 10 months. And I don't think I could sleep without it, to be quite honest. And with that, people say, well, does that mean it's addictive? I'm like, no, I wasn't sleeping before. Is there any side effects? I haven't had any side effects at all, except that I feel better because I'm actually getting a full night's sleep. So anyway, let me show you how to use these. So again, this is called the FlexPulse. This is the box, and there will be a sort of like a rubberized case that all of the contents will be in. When you take all that contents out, you will see a little disc like this. This disc here is the charging unit. You will then put the wire, of course, in that charging unit so you can use, and there it is, and it just goes a USB plug and you plug it into the wall. Then when the FlexPulse, this little unit here, okay, it looks like a little portable TENS unit, okay, will go on this pad. And when it goes on this pad, the pad will turn blue, let you know that it is charging. It'll take about 3 or 4 hours to fully charge it, and then you can take it off and use it tonight, and then put it back on for charge the next day. So let's get the charger off to the side, okay? These here are the leads. There are 2 of them. The leads have a pad, and then it has a hook. The hookup, of course, goes into the FlexPulse. There's only one way that they go in there, so don't worry, you're not putting them in backwards. If they don't fit, that means they're not in the right way. They are difficult to get in there a little bit, but they'll go in, and that is correct, like that there. And you can put 1 or 2 leads in there. I use 2 leads. Basically, you're doubling the intensity of the unit by using 2 leads. So then, now the leads are hooked up and it's fully charged. You will turn it on by this little button on the bottom that has a dot onto it, and you hear it come on. When you take a look at this, there looks like 2 volume buttons, like a up and a down on the right and left. So when you take the one on the left and you go up and down, okay, what you're doing at that point is you're changing different intensities. Keep it at 10. Some people do feel a little nauseated at 10. If that's the case, maybe drop back and do it, at 6 or 7, then every couple nights, rise it up a point or 2, but eventually you want to get to 10 where the unit is fully functional. The right side up and down arrows is time. You keep hitting it up and it'll go 50 minutes, then an hour, then 2 hours, 4 hours, 6 hours, and then you hit it again and it goes continuous. That's where you want to have it, because you want to have it on continuously all night, okay? The P button on top, when you hit P, that's a program button. There's lots of different programs in here. Let's go off and talk about first program 1. Program 1 is the one that I want you to use. Program 1 automatically puts the unit at 3 hertz, which means, again, it's going to pulse at 3 times a second. It'll just you'll hear a faint tick, like tick, 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 like that, 3 times a second. So you're going to have it on program 1 to sleep, and then you're going to take both of these leads. Remember, you're going to have 2 plugged into the unit, and you're going to put them on top of your pillow, but in under your pillowcase. So while it'll be sort of like sandwiched between your head, then it'll be the pillowcase, then this unit, the pads will be there, and then your pillow. It's a little, bumpy in the beginning, but after a while you don't even know that it's there. So I put 2 in the pillowcase. To increase the intensity, what you can do is you can stack both of these pads on top of each other. I find it a little bit annoying because it increases the volume of the tick, 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 and I find it distracting. So what I do, however, is I put one on the bottom part of my pillow, one at the top part. So one is basically right at where your skull makes onto your neck, and the other one is probably closer to the top of your head. That's what works well for me, and it decreases the volume of the ticking sound. Okay, so what you'll do then is you'll put this somewhere off to the side, the units, because you don't want it to turn off in the middle of the night, and you put it in your pillow, and you're just going to lay asleep onto it. Okay, so then when you get up in the morning, you can just turn it off and charge it again. So again, I've tried every potion and lotion that you can imagine and every device, and nothing has worked, but this thing has. Basically, my experience was when I would go lay my head down to go to sleep at night before I found the FlexPulse, it would seem like my mind would race. As soon as I would close my eyes, my mind would race more. Sort of what some physicians have told me is what maybe an ADHD child sounds like, because obviously there's an adult ADHD as well. Maybe that's my true diagnosis. But anyway, by having this here under my head, what happened is it calmed my brain down, and all the background noise and all the excessive ramping of your thoughts and rumination and all that all just went away, and I just drifted off to sleep. It's been a godsend for me, and I hope it's a godsend for you. These devices are somewhere around $1,200 to $1,400. Now I'm going to be doing some work with the company that makes them, and hopefully I'll be able to get you a promo code so you can get some price reduction on it. But I also don't want you to waste your money if it's not going to work for you. So what we've done is we've put them in our office, and we're going to rent them out for $100 a week. That way, if you get it and it doesn't work, well, you're out $100, but that's a whole lot better than being out $1,200. So I would rather you try it and see if it works for you, rather than for you to just go buy a unit and end up being garbage and it doesn't work for you at all. But again, I think it is going to work for you because it worked well for me, and believe me, I tried everything. Some of the other programs in here, like this FlexPulse was not meant just for sleep. There's other things. Like if program 2 is 7.8 hertz, which is, if you feel sort of spacey some days, that's what they call the grounding frequency. Then if you want to, studying or you're reading and you want to concentrate, you can get onto 10 hertz, which increases your brain waves and then makes you focus a little bit better. But let's face it, you're not going to go to sleep. So I can't contest to whether all of those other programs work. The only one that I can contest to is the sleep one, which is program 1, 3 hertz. So that's really what this video is about how to help you sleep and how to use program 1. You can experiment with it if you like on the other ones. Maybe you'll get additional benefits more than sleep. I kind of hope that you do. However, this video is only about sleep. So try this. If you've been having trouble sleeping, it may be the answer you've been looking for. And again, it's very, very low risk to just come get one for a week. If it does work for you, make sure that you let your physician know, your chiropractor know, whoever it is that prescribed one for you, and tell the world has a lot of sleeping problems, and if we can be a part of the solution, I would consider that a great thing. Thank you so much. I hope this works for you. Until later, I'm Dr. Short, Bluegrass Chiro.